And so Laura's work focuses on patterns and consequences of social inequalities and exposure to environmental hazards in the United States. She has done a lot of really interesting work at the nexus of environment and climate related exposures, in particular, looking at pregnant women and infants. And she's investigated many questions of environmental justice in the context of air pollution, hazardous sites, green space, heat islands, oil and gas drilling, the list goes on. She just had a really interesting paper come out on environmental justice considerations around sea level rise. So Laura is currently a JPB Environmental Health Fellow through the Harvard T.H. Chan School of Public Health. She received her PhD from the Energy and Resources Group at the University of California at Berkeley. So Laura, thank you so much for being here with us today. I'm going to hand it over to you for your presentation, and we'll hold questions until the end. So we'll give Laura the floor, and then please afterwards, I think we're a relatively small group, so you can unmute and ask questions. So thank you very much. And again, Laura, congratulations, and thank you for being here.
Thanks so much, Joan, for that really nice introduction. I'm going to go ahead and share my slides. Is that coming through?
They look great.
Okay. So I'm really honored to accept this award on behalf of myself and my co-authors. And given the topic of the paper that garnered the award, I thought I'd focus my remarks on sort of the intersections between climate change, environmental justice, and health, and why it's important to make the connections between these things in order to advance health equity. To start, let me acknowledge that as a member of the UCLA faculty and community, I benefit from the use and occupation of the traditional, ancestral, and unceded territory of the Gabrielino Tongva people, and pay my respects to them as the traditional caretakers of the land on which UCLA campus sits. And let me begin also by emphasizing, the threat that climate change poses to public health. I know this audience is going to be very familiar with this. Climate change has been called, kind of the code red for humanity, for a healthy future, and in many ways could potentially be catastrophic for human survival, and is likely to undermine the last half century of gains in global health, and really constitutes a medical emergency. And if you haven't read it yet, the most recent Lancet Countdown, which is penned by an independent international multidisciplinary collaboration and monitors the health impacts of climate change, through a series of indicators, really shows the growing impact that climate change is having on public health around the world. We also know that the impacts of climate change are highly unequal, and need to acknowledge what Rachel Morella-Farache and Manuel Pastor and colleagues have dubbed the quote unquote climate gap. The fact that people of color and the poor will experience greater impacts, both globally when comparing across countries, as well as within our own countries and communities. And that will be in the form of higher mortality and morbidity due to extreme weather events, worsening air quality, etc. We're also likely to see the spending gap widen as the costs of things like food and water and energy go up. Low-income households will be spending a larger proportion of their income on basic needs. And job losses and shifting economic opportunities. People of color are overrepresented here in California in industries like tourism and agriculture that are very climate sensitive. And so with respect to health, we need to be thinking about the ways in which climate change presents risks to individual health are really determined by these three factors in the Venn diagram shown here. The exposure you might have to climate-related hazards, your social vulnerability and or susceptibility, and your adaptive capacity. So if we think about the example of heat, localized heat island effects can result in greater exposures. And these might come from living in a neighborhood, for example, with little vegetation, a lot of heat trapping surfaces like asphalt and concrete, can lead to higher temperatures in socially disadvantaged neighborhoods that tend to be less green. Similarly, socially disadvantaged populations might be more vulnerable to the health effects of heat due to perhaps overrepresentation in industries where you're paid piecemeal and you don't get paid if you don't work. So, and you can't really control your work environment. For example, agriculture, you don't get paid if you stop to take a break on a hot day. So you might be more, by nature of your occupation, really made more vulnerable to a specific extreme weather event. And then finally, adaptive capacity, refers to things like your access to air conditioning or healthcare that might help you adapt or recover from an exposure, like an extreme heat exposure. So, in summary, much like the COVID pandemic, climate change is really we expect to really lay bare and further exacerbate existing and growing social inequalities that already result in disparate health and well-being along race and class lines. The good news is that, most actions that we could take to mitigate and adapt to climate change are likely to be beneficial in terms of reducing inequality and improving health. So one recent study, suggests that greenhouse gas reductions in line with the Paris Accords would save millions of lives globally through things like better air quality, diet, physical activity. And with respect to environmental justice in the US, we might see better air quality in environmental justice communities, frontline communities living on the fence line of industry who live near pollution sources if we were to reduce our emissions. So that's the good news. And of course, in many ways, we already know what we need to do and have the technology to decarbonize our economy. And if we do it right, there's likely to be a lot of public health and environmental equity benefits. So with that introduction, I wanted to talk about 3 climate justice related projects. So I'll first talk about the paper that garnered the award, which focuses on the environmental equity implications of California's cap and trade program to reduce greenhouse gas emissions. And then I wanted to talk briefly about 2 more recent projects that also aim to shed light on the disparate potential health impacts of climate change on communities of color in the US. So the California's cap and trade program is the 4th largest operational carbon trading program in the world, or at least it was at the time that we wrote this paper in 2018. And it regulates large point sources of greenhouse gases, including things like power plants, manufacturing, refineries, etc. And each regulated entity covered under the cap is required to surrender what are called allowances, or you could think of them as permits to pollute. And you have to surrender 1 for every ton of greenhouse gases that you emit. At the beginning of the program, over 90% of allowances were given away freely. But after that, the allowances need to be or can be bought and traded on the market, carbon market, such that a company, as shown in the schematic here, could reduce their emissions to meet their compliance obligation going forward, or they could choose to continue emitting the same levels of greenhouse gases or even more than they previously did, and purchase allowances from someone else to cover those emissions. The total number of allowances on the market is established by the cap, which decreased by about 3% per year from the start of the program when trading began in 2013 through 2020, and then decreases by about 5% from 2020 to 2030, with the goal being a cumulative emissions reductions of about 50% from the regulated entities participating in the program by 2030. But that emissions reductions, of course, they don't need to occur locally because, as I said earlier, companies are allowed to trade their pollution permits with each other. And in addition to that, the reductions can actually happen beyond California's borders in the form of cleaner electricity being purchased from power plants outside the state, and credits garnered through authorized offset projects in sectors like agriculture and forestry that are kind of beyond the cap. So because of that, the health benefits could be very variable because we don't know where emissions reductions will take place. And that's sort of illustrated here on this slide. Greenhouse gases, inhaling them is not very damaging to your health. They're only damaging to health in the sense that they cause climate change unless you're exposed to like really high levels. But they tend to be emitted with other co-pollutants that are hazardous to health. So like in this example here, these two facilities are both regulated under California's cap and trade program. They both reported emitting between 2.5 and 3 million tons of greenhouse gases in 2014. But the one on the right emitted about 10 times as much particulate matter as the one on the left. And there's also many more people living near the oil refinery on the right than near the power plant on the left. So you can imagine that if greenhouse gas emissions reductions also resulted in kind of similar reductions in particulate matter, the benefits of reducing at the facility on the right in terms of public health would probably be much larger than those on the left. And this is exactly the concern or part of the concern that environmental justice advocates had raised very early on in discussions about establishing a carbon market, because of the concern that carbon trading could allow for the persistence or potentially even the worsening of air pollution hotspots in disadvantaged communities, because there's no guarantee that any individual facility would reduce their emissions under the program. So that's the concern that we really set out to investigate with this study published in 2018. Specifically, we asked, how have emissions of greenhouse gases and hazardous co-pollutants changed since the start of California's cap and trade program? And where did those changes take place? And is cap and trade actually reducing social disparities in emissions burdens like we hope that it might? To answer these questions, we combined data on annual facility level emissions of air pollutants from two sources, the California Air Resources Board, which collects data on greenhouse gas emissions, as well as these other pollutants listed here. And for a small subset of facilities that participate in the federal toxic release inventory, we also looked at their air toxic emissions as reported to the US EPA TRI program. And then we combined emissions information with neighborhood demographic information at the block group level from the American Community Survey and from a tool called CalEnviroscreen published by the California EPA, which I'll talk a little bit more about in a second. So what did we find? First, we found that in-state emissions of greenhouse gases actually increased during the first 3 years of the program. Let me actually go back a second and just say that we focused on the first 3 years of the program, which correspond to the first kind of compliance period, because that was the data that was available at the time we were conducting this work. And throughout what I'm going to show you, we compared to the 2 years prior to 2013 and the start of trading, because we couldn't really go back farther because reporting requirements for greenhouse gases changed in 2010 a little bit, such that 2010 data were not comparable to subsequent years. So in each case, we're comparing the 3 years after the start of trading to the 2 years prior. And so we found that in-state emissions of greenhouse gases actually increased during these first 3 years of the program as compared to the 2 years prior. So in the chart, you can see that, for example, among the 9 regulated cement plants here in yellow, most cement of these 9 regulated cement plants, I have to remind myself how to read this chart. Most of them reported an increase in their annual average in-state greenhouse gas emissions, with the median being about 100,000 tons of CO2 equivalent. And then some sectors, were more likely to decrease their emissions, like the cogeneration plants shown in the purple color, light purple. We then took a look at the degree of correlation between greenhouse gases and co-pollutant emissions, because it hadn't really been empirically established that, you know, if you reduce your greenhouse gases, you're also likely to see less co-pollutant emissions. And there's a number of strategies that industries can take to lower their greenhouse gases, and not all of them would be expected to also lower emissions of other co-pollutants. So what's shown here on this slide are the mean percent changes in co-pollutant emissions per 1% change in greenhouse gas emissions that we estimated based on annual data across the 256 facilities in our sample. So you can see, you know, it's not a one-for-one correlation, but you see somewhere per 1% change in greenhouse gas emissions, you see something a little less than 1% change in air toxics, nitrous oxides, fine particulate matter, sulfur oxides, and about 0.5% change in total volatile organic compounds, or VOCs. Unsurprisingly, we found that socially disadvantaged communities were more likely to live near regulated facilities. That's very consistent with prior research in California and elsewhere, demonstrating that low-income communities and communities of color are more likely to live in close proximity to polluting industries. So in orange is the proportion of residents that identify as people of color in California block groups, categorized from left to right, according to the number of regulated facilities with within 2.5 mile distance of the block group centroid. So you can see that the proportion of people of color increases the more facilities there are nearby. And same thing in blue when you consider the state designation of disadvantaged community, which is based on an environmental justice screening tool called CalEnviroScreen, which combines about 20 indicators of pollution burden and population vulnerability to the health effects of pollutant exposures to assign a relative ranking to census tracts in California. So these are the highest 25% of census tracts that score the worst on the screening tool are considered quote unquote disadvantaged for regulatory purposes. So I should clarify here that in looking at race and ethnicity, you know, we're using these measures as kind of proxies for experiences of discrimination or racist treatment. So a marker, if you will, of the degree to which communities are on the receiving end of structural racism. And also, since this 2.5 mile distance is really quite arbitrary, we did look at a 1 mile distance throughout the analysis, but I'm focusing on the 2.5 miles because the 1 mile, the results were very similar. We also found that poor communities and communities of color were more likely to experience increases in emissions from facilities nearby. So on the y-axis here, in orange again, are the proportion of people of color, and then in green, it's the proportion of the population living below twice the federal poverty level. The light colored bars represent the block groups where annual average aggregate emissions of greenhouse gases from all facilities within 2.5 miles decreased post-trading as compared to pre-trading. And then the other bars are block groups that experienced increases in aggregate emissions of either greenhouse gases alone or greenhouse gases and one other pollutant. So you can see the largest disparity on both graphs is in neighborhoods where greenhouse gases and particulate matter both increased, and greenhouse gases and air toxics both increased. When combining these variables into a multi-variable model, we found that among the markers of social disadvantage that we examined, race ethnicity was really the most strongly and consistently related to the likelihood of experiencing emissions increases, independent of population density and the other variables listed here, which are all standardized. So the way you would interpret this highlighted row here is that, you know, per standard deviation unit increase in the percent people of color in a neighborhood, the odds of aggregate emissions increasing nearby was 12 to 78% higher compared to block groups that experienced emissions decreases and holding all other variables constant. So in summary, this work demonstrated that greenhouse gas emitting facilities in California are disproportionately located in disadvantaged communities, that in-state emissions of greenhouse gases increased for several industry sectors and were accompanied by increases in co-pollutant emissions. Communities of color were more likely to have experienced emissions increases, and this work suggests that more localized emissions reductions in disproportionately impacted communities could improve the public health and equity co-benefits of this climate mitigation program. Some of the limitations, we only assessed emissions burden, which might not mirror, so the patterns we observed, might be different if we were to look at actual ambient air quality resulting from those emissions, which can travel, long distances. We did not consider greenhouse gas emission sources from other sectors like transportation, which is actually the biggest source of greenhouse gases in California. This was a preliminary assessment focused on the early years of the program. So, as the cap is decreased and the regulations get more stringent, things might change and look different. And we have been working on sort of an update to this analysis. And, legislation in California requires that a significant proportion of the proceeds from the cap and trade program are actually invested in mitigation projects that benefit environmentally and economically burdened communities. So we didn't look at that in this study. So that fact might also help realize future localized emissions reductions in disproportionately impacted communities. Okay, so let me turn now to, I wanted to share just a couple more recent projects. The first is about social disparities and vulnerability to heat related to preterm birth. So in this study was really motivated by, the fact that with climate change, extreme heat events are becoming more common and severe. We know that they can cause increased mortality, particularly amongst the elderly. You tend to see more hospitalizations and emergency room visits for a variety of conditions during heat waves. And an increasing number of studies have suggested that acute heat exposures can result in increased risk of preterm birth, which is what I'm going to focus on. Prior work also shows in the US, African Americans are often more severely impacted during heat events, and they have a much higher preterm birth rate than non-Hispanic whites, about 60% higher if you look nationally. In addition, neighborhood land cover characteristics can exacerbate heat island effects and cause kind of hotter neighborhoods within cities. And you'll see that with neighborhoods that have less vegetation and more impervious heat trapping surfaces like asphalt or concrete. And these types of land covers are unequally distributed with respect to race. So, we might expect that with climate change, extreme heat events will exacerbate existing racial disparities in preterm birth rates that we're already struggling to reduce. So to kind of look at this question, we looked at a landmark heat wave in Texas in 2011, focusing on the Houston area, and asked, using administrative birth records, is extreme heat associated with higher risk of preterm birth? And do disparities in neighborhood land cover or segregation put people of color at higher risk? The study design was a retrospective cohort study using administrative birth records, as I mentioned, focusing on Harris County, which is home to Houston, the 5th largest metro area in the country, We looked at 5 years of birth records that included that landmark heat wave in 2011, which was the hottest summer on record. Average temperatures that summer were over 2.5 degrees Celsius above the long-term average. We assigned daily temperature to each birth based on the closest of 10 weather stations to the birth parent's residence as recorded in the birth record, and focused on acute daily exposures for up to a week prior based on the previous literature, looked at both absolute and relative measures of heat, dry bulb temperatures, and apparent temperature, which is an index combining dry bulb temperature and humidity that kind of better approximates how hot it actually feels. And then looked at census tract level effect modifiers. The first being a measure of racialized economic disadvantage called the Index of Concentration at the Extremes, or ICE. This value measures it measures the extent to which disadvantaged and privileged populations are concentrated in an area in a census tract in this case. So it ranges from -1 to 1, with -1 meaning the entire tract belongs to the most disadvantaged group, and 1 be the entire tract population belongs to the privileged group. And we defined disadvantaged here as people of color with an annual household income less than $25,000, and the privileged group as non-Hispanic white individuals with an annual household income above $100,000. We also looked at what we called high heat risk census tracts, which this was a yes/no variable. They had, if they had no water, less than 5% tree canopy cover, and over 60% impervious surfaces, we called them high heat risk. And then we estimated the risk of preterm birth versus staying pregnant using survival analysis with gestational age as the time axis. And we found that the strongest association was with the prior day's temperature, and estimated a 15% increase in the risk of preterm birth the day after a very hot day, defined in 2 different ways. The effect estimate was actually the same. So this graph here shows maximum apparent temperatures greater than 40 degrees C versus less than 20. And the highlighted hazard ratio on the graph controls for secular and seasonal trends, as well as a number of individual level risk factors for preterm birth, like the birth parent's age, the degree of prenatal care, education, whether they're foreign born, their race, ethnicity, their socioeconomic status, and a few other things, smoking, whether they had gestational diabetes or hypertension, etc. We also saw stronger associations earlier in pregnancy, which is concerning because the consequences of preterm birth are more severe the earlier a baby is born. I should have said at the beginning, for those that might not be as familiar, preterm birth, is a primary risk factor for infant mortality, particularly the younger the baby is born, and has also been associated with long-term health conditions even into adulthood. So here that I'm highlighting again the 15% overall association that we saw, 15% higher risk following hot days. But when we censored at earlier time points in the pregnancy, the effect estimate increased, and with the extremely preterm, the risk was about 3 times higher compared to low temperature days. And then again, looking at associations across degrees of neighborhood segregation and concentration of racialized economic disadvantage. So here again, I'm highlighting the overall estimate of 15% higher risk. But when we stratified by quintile of this ICE measure that I described, we saw that the association was really only statistically significant in the most disadvantaged census tracts, where we estimated a roughly 30% higher risk following hot days. When we assessed interaction on the additive scale, this suggested a statistically significant higher risk difference in these neighborhoods of concentrated racialized economic disadvantage. So conclusions from this work where that ambient heat was associated with preterm birth, and that's consistent with, like I said, there's been an increasing number of studies showing this from around the world, from Europe, the US, Australia, China, but often in more temperate climates. So, this population is very used to high temperatures, but we still saw that association here. Risks appeared to be higher in early pregnancy, which is not something that I had seen reported a lot in the literature, and again is concerning given the more severe consequences of a early preterm birth. I didn't show this, but we didn't see much evidence that neighborhood land cover, those land cover characteristics that I talk about, really exacerbated the risks. But what we did see was that there was interaction with racialized economic disadvantage and segregation. So, the takeaway from this study, which is forthcoming in the next month or two, is that climate change may worsen existing racial and socioeconomic inequalities in preterm birth rates. And focusing on neighborhoods with the greatest concentrations of racialized poverty, in our analysis, it suggested that would prevent the most preterm births during a heat wave. Some of the limitations, we didn't have any information on stillbirths or miscarriages. So if extreme heat similarly caused miscarriages, we may have underestimated the true association between heat and preterm birth because of differential fetal loss among those with underlying susceptibility. We likely had exposure misclassification due to a lack of information on things like housing characteristics, physical activity, et cetera, that would help determine your individual exposure to heat during a hot day. Similarly may have suffered from potential unmeasured confounding, maybe by occupation, which is related to socioeconomic status, and therefore we might expect to be related to underlying preterm birth risk, and could also determine your ability to kind of control your work environment during a hot day. But we did control for other markers of SES in our analysis. Okay, and finally, I wanted to share one other project related to sea level rise and the environmental justice implications of sea level rise, and hopefully talk a little bit about how research and data could be used to inform policymaking and climate adaptation and resilience planning. So the motivation for this project is the fact that sea levels are rising. We expect by the end of the century, unless we really change course in terms of our greenhouse gas emissions, likely 3-foot increase in sea level rise in California. And on top of that, we have a lot of industry right along the coastline and in low-lying areas, and a lot of legacy contamination sites from industrial and military activities along the coast. And during flooding at sites like that could lead to contaminant releases, unintentional releases of hazardous substances stored or emitted at the site, are used at the site through floodwaters, contaminating potentially soil, water, and real acute storms like Hurricane Katrina, Harvey, have shown how air pollutants are often released during flood events from petrochemical industries, either by accident or even intentionally to avoid something even worse from happening. So that was the motivation for this project, which sought to characterize the threats posed by sea level rise and the potential flooding of hazardous sites to socially disadvantaged populations in California. We wanted to create an online mapping tool that visually depicts where these facilities, potentially hazardous facilities, are located, and associated socioeconomic conditions. with the goal of really sharing the findings with advocates and decision makers in order to inform efforts to protect vulnerable communities in emerging climate resilience policies. It was a community academic collaboration. And we had an advisory board of a number of leaders from environmental justice organizations in the San Francisco Bay Area, Los Angeles area, and Central Coast areas of California. We are planning to expand this work nationally. So we've been adding or wanting to add some folks from the East Coast and the Gulf Coast to help advise on the project. I'm not going to go through everyone's names, but you can see the organizations here. And it really was an iterative kind of process of figuring out what we wanted to look at and improving the methods and as we went along over the course of about 3 years. And so together we asked, how many and what types of hazardous sites are threatened by flooding due to sea level rise and who might be impacted. So what are the characteristics of populations living close to these at-risk sites? Very briefly, I'm going to gloss over a lot of the details here, but we combined data on the locations of potentially hazardous sites, and I'll show you what types of sites and facilities we considered. From multiple national databases, we did a number of things to try to improve the accuracy of the locational information and better represent the extent of site boundaries. Our collaborators at Climate Central then projected flood risk at each of these locations in the near term, 2050, and the long term, 2100, under both low and high greenhouse gas emission scenarios. And then on top of that, we added several metrics of population vulnerability, mostly derived from the American Community Survey again. We also looked at affordable housing, constructed a measure of civic engagement from voter turnout data for California, and looked again to the CalEnviroscreen tool that I talked about previously. This work is still preliminary, so please don't cite, but our preliminary findings suggest at least 440 facilities at risk of flooding by the end of the century under a high emissions scenario, which is kind of the trajectory that we're currently on. And you can see the type of facilities that we looked at here: power plants, concentrated animal feeding operations, sewage treatment plants, etc. And about a fifth of the state's refineries and sewage treatment plants were projected to have at least one flood event in the year 2100 under this scenario, with the Bay Area and kind of Los Angeles, Southern California area being home to the most number of facilities. We also estimated that disadvantaged communities, as defined using CalEnviroscreen again, had a higher odds of living near one of these at-risk facilities within 1 kilometer, and lower voter turnout, higher poverty, lower home ownership, more people of color, more linguistically isolated households were all also associated with a higher odds of living near at-risk facilities. We generated this online mapping tool, which you can visit and explore, that includes a number of maps where you can find out about at-risk facilities in your neighborhood, if you live in California, that is. For right now, that's what we have available. And you can click on different facilities, find out more about them, as well as their projected flood risk. We also show at the neighborhood level, the projected number of at-risk facilities within 1 kilometer, and various demographic indicators, poverty, percent unemployment, etc., that you see here. So in conclusion, I know I kind of raced through that, but I wanted to save time for questions. So, hopefully this type of work can serve as an example of kind of community-driven and data-driven tools that might inform local decision-making. And this is a kind of bird's eye view of potential risk. We didn't drill down to specific sites or regions. So we think of this as, you know, a way that we might prioritize future research and site-specific evaluations related to sea level rise and potential contaminant releases. And those site-specific evaluations could include additional information about sites that we didn't have access to, including things like groundwater plumes, which we did not look at, but would also spread under conditions of sea level rise and potentially present exposure risks. And our hope is that, you know, tools like this can help adaptation and climate resilience planning, make sure that it takes environmental justice concerns related to sea level rise into account. More and more municipalities and county, state governments in California are undertaking adaptation planning efforts and climate resilience efforts. So we're hoping that this will help make sure that environmental justice is part of that conversation and front and center to it. And, you know, reflecting on the project, the community engagement component certainly strengthened the science and in terms of making it more rigorous. So our partners, you know, help to ground truth some of our data, point out important sites in their communities that were missing or not accurately represented. They also helped ensure we were asking the right questions and that the work was relevant to ongoing policy discussions. And they hosted, and are still in the process of hosting a number of webinars and roundtables to share the work with local communities and decision makers and make sure it has, you know, a broad reach. So with that, let me thank my collaborators and from Berkeley, UCLA, the University of Southern California, Occidental College, and Climate Central, all of which have contributed to different parts of what I've presented, and the funders here that have supported pieces of the work that I've shown you. Thank you so much. It's been a pleasure to share this work. Here's my contact information and my Twitter handle. I'm very occasionally on Twitter. If any of this work interests you, please do get in touch. I'm very happy to talk about collaboration and to hear from you. So thanks a lot.